This guy's doctor gave him a probiotic to stop the Hershey squirts. A few weeks later, he was dead. Let's get into how your healthy supplement can literally murder you. Imagine surviving colon cancer, a heart that's basically a time bomb, and a bout with COVID-19 that lands you in the ICU for a month. You finally catch a break, and your doctor gives you something to help with, the runs. And then that helpful supplement proceeds to murder you. Welcome to the most ironic medical case of the year, where the friendly bacteria were anything but. Let's meet our main character, a man in his 70s we'll call Mr. Tanaka. Now, if pre-existing conditions were a bingo card, Mr. Tanaka was one square away from yelling, "Bingo!" and winning a lifetime supply of medical bills. He had a history of colon cancer, a cardiovascular system that was more clogged than a public bathroom at a music festival, and a liver that had personally filtered enough ethanol to power a small rocket. Smoking? Of course. This guy's baseline health was, "Please don't cough near me." One day, Mr. Tanaka decided to get intimately acquainted with his living room floor. When the paramedics hauled him to the ER, doctors discovered his blood was turning into acid. Not a metaphor. He had severe metabolic acidosis, meaning his bloodstream was more toxic than your ex's text messages. The cause? A perfect storm of a lung infection, kidneys on strike, and a liver that had frankly given up. Just to make sure things were truly interesting, COVID-19 decided to join the party. Faced with this new threat, the doctors deployed the big guns, a cocktail of hardcore immunosuppressant medications. Think of it like using a fire extinguisher that puts out the blaze by sucking all the oxygen out of the room. It worked. It saved him from COVID's inflammatory hellscape. But the trade-off was brutal. It left his natural defenses so compromised that a stiff breeze could have given him a fatal infection. The cure, in this case, was a double-edged sword sharpened on both sides. After a month-long brawl in the ICU, Mr. Tanaka finally stabilized, but the life-saving drugs had a classic side effect, a case of diarrhea so relentless it could have its own weather channel. To plug the dam, his doctors did what seemed logical. They prescribed a probiotic containing Clostridium butyricum, the same friendly bacteria millions of people take to make their guts less of a war zone. What could go wrong? For a few weeks, it worked. The digestive meltdown calmed down. All was well. Then, on his 58th day in the hospital, his body unleashed the final boss. He was hit with crippling abdominal pain, and his stomach swelled up like he was trying to hatch an alien. CT scans showed his intestines were on a blood flow strike. His blood was, once again, approaching battery acid levels. The doctors drew blood to find the culprit. The results came back positive for Clostridium butyricum, the exact same strain from his probiotic pills. A genetic test confirmed it. A perfect match. The friendly bacteria had staged a jailbreak from his gut, tunneled into his bloodstream, and were now throwing a rave in his veins. This is called probiotic-related bacteremia, and it's the medical equivalent of your security guard helping the burglars carry your TV out the door. Mr. Tanaka's body, already running on fumes, went into total system failure. The bacterial rave in his veins shut down his organs. Surgery was off the table. He was too far gone. After 60 days in the hospital, his care was switched to make him comfortable. He survived cancer and COVID, only to be killed by the one thing that was supposed to be harmless. The investigation painted a picture of the world's worst roommate scenario. The probiotic moved in to help with the cleaning, the diarrhea, but then it started throwing ragers in the bloodstream and refused to pay rent. Researchers confirmed this was the first time the roommate had actually burned the whole damn house down, and a background check showed it had a history. 5 other people had filed complaints about this same bacterial strain trashing their place. It wasn't a helpful friend. It was a freeloading squatter with a history of property damage. Listen up. If you're a healthy adult, you can probably keep chugging your kombucha. The people who need to worry are those with immune systems that are basically on an indefinite vacation. We're talking the elderly, people with multiple health issues, or anyone whose defenses are down thanks to strong meds. Mr. Tanaka was the poster child for this risk group. This whole mess forces an uncomfortable question. How safe are our safe supplements? For most of us, the risk is tiny. But for a vulnerable person, that little pill can be a Trojan horse. It's a reminder that in biology, there are no free lunches, only potential food poisonings. Mr. Tanaka's story is a brutal lesson that in medicine, there's no such thing as a completely risk-free ride. It doesn't mean you should yeet your probiotics into the sun, but maybe we should stop treating them like magical health fairy dust, especially when our bodies are already on the ropes. So, if your guts aren't currently trying to assassinate you, how about you show some appreciation? Smash that like button, tell me in the comments if you'll ever look at your yogurt the same way again, and subscribe for more stories that make you question every single one of your life choices. It's free, and frankly, it's cheaper than the therapy you're gonna need after watching my videos.